Hello, everybody. My name is Nadia, and today I will be discussing the psychoanalytic theory by Sigmund Freud. So, the psychoanalytic theory began its development in the 1890s through the studies of hysteria. And at the time, hysteria was explained as a consequence of repressed trauma. It was a medical condition. And so when you thought of hysteria, you typically thought of women who were out of control. And so a lot of these symptoms had paralysis, fainting, loss of sensation, and blindness. It's interesting though, hysteria was often linked to a sexual component of sexual trauma and repression of violations of that nature. So while it was originally thought to be a physical condition that had some basis in neurology and biology as opposed to events that occurred throughout one's life, Freud decided to elaborate on and expand upon its mental basis. And so he fully developed his psychoanalytic theory in the late 19th century. According to the psychoanalytic perspective, behavior is determined by unconscious beliefs and desires. So we have the conscience, which is what we are actively aware of at the moment, and the subconscious, which is everything that lays beneath that conscious level, what we don't actively think of but we know, or in this case, particularly what we don't know, but we do have access to. The psychoanalytic theory proposes a reality of instincts, or life instincts and death instincts. And then similarly, it uses the word libido or sexual attraction as a life instinct. So a life instinct is meant to contribute to survival by fostering growth, development, and creativity. Life instincts are typically thoughts, feelings, and behaviors which increase pleasure and decrease pain. And then in contrast, death instincts are the antithesis of life instincts, and they function to assist in the engagement of aggressive behavior that could result in harm towards oneself or others. So life instincts, anything that contributes to life; death instincts, anything that would do the exact opposite. So some other key components that we're looking at with this theory here, it states that the personality has three systems: the id, the ego, and the superego. So the id is all the untamed drives and impulses that a person has. It's basically like the toddler that's running around out of control, screaming, crying on the airplane, that basically can't think about anybody but themselves and what they want, and they want it now. Versus the ego is the organizer and the mediator between the id and the id's impulses. So it's kind of like that parent saying, hey, I'll meet you halfway there. Let's negotiate this. How can we meet a compromise that works well for both of us in this particular situation? And then for the superego, it's an internalized social component. It's largely developed by what an individual considers to be expectations of authority figures, and it typically reflects your values, morals, and a sense of direction. So think your higher purpose or your highest best self would be attached to your superego. So moreover, the psychoanalytic theory states that throughout the first 6 years of someone's life, they undergo the psychosexual stages of development. And these are oral, anal, phallic, latency, and genital. So throughout all these different stages, these all occur throughout your entire life. You are developing different components of your character, of your person, of your personality. So in the oral stage, you have an inability to trust oneself or others, so you can't trust yourself, you can't trust others, resulting in the fear of loving and forming close relationships, and then also it's characterized by low self-esteem. This is typically seen in infants, and there's an emphasis on oral stimulation, such as a kid who sucks their thumb. and we'll come back to that in a moment. Next is the anal stage, deals primarily with the inability to recognize anger, leading to denial of one's own power as a person and the lack of a sense of autonomy. There's the phallic stage, which deals with the inability to fully accept one's sexuality and sexual feelings, and it has difficulty in accepting oneself as a man or a woman. So all of these stages would occur before the age of 6, in that very rapid period of development. And then moving forward between ages 6 to 12, the latency stage. And this is characterized by sexual impulses, which are repressed, and their energy is channeled, and energy in general is channeled into social and personal development. And then the genital stage, everything from adolescence into adulthood, is in a stage where sexual impulses are reawakened and healthy adult functioning is achieved. So, disruption in development throughout any of these stages is going to result in a stunting of growth or development. For example, an individual stunted in the oral stage may be theorized to struggle with smoking as an adult. And then the goal of counseling, when utilizing the psychoanalytic perspective, is going to take into consideration all these possibilities and how that may influence the individual. So, when using the psychoanalytic perspective for therapy, the objective is to make the unconscious conscious, to unravel the subconscious, and to strengthen the ego. So the therapist has the role of being a blank screen. We call this a blank screen approach. In this method, the therapist avoids self-disclosure. They maintain neutrality to foster a transference relationship. So think of transferring from one person to the next. And in this particular relationship dynamic, a client projects onto the therapist. So this is typically when we also think about someone laying down, facing away from the therapist, and the therapist taking notes. It's definitely not as heavy on connecting with the client in an emotionally reassuring way that you might see in client-centered or patient-centered therapy. It definitely still deals with personal internal elements of the client's world. However, it's done from a more reserved approach. So the client projects or transfers in that transference relationship onto the therapist. And the theory is that by revealing little personal information, the client will focus on feelings in association to their past or what's coming up for them in that moment. Analysis of the thoughts, feelings, behaviors that come up during this period enables clients to acquire freedom to love, work, and play. Other functions include assisting in developing self-awareness, honesty, and more effective personal relationships. So this process is really meant to help an individual release their inner inhibitions, or anything that could be potentially stunting them in a reserved position. Classical psychoanalysis includes engagement in free association, which basically refers to freely expressing thoughts, feelings, and behaviors. Nothing is off the table. In fact, the more personal or vulnerable the information that you disclose is, more often than not, the more likely the outcome of that conversation is going to be more successful and influential. So, psychodynamic therapy emerged as a result of condensing classical psychoanalysis. And I wanted to go back and talk a little bit more about transference and countertransference and how it's referred to in this setting. So, transference includes the client's unconscious shifting to the transference includes the client's unconscious shifting to the analysis of feelings, attitudes, and fantasies, both positive and negative, that are significant to them as they project that onto the therapist. And then for countertransference, countertransference is a phenomenon that occurs when there is an inappropriate effect, or when the therapist responds in an inappropriate way. So typically in this relationship dynamic, the therapist is with the client. The client examines their thoughts, feelings, behaviors, attitudes in an unbiased way. They're very raw, they're very vulnerable. Through the sharing of that information, we call that transference to the therapist. They're able to lean closer towards self-actualization. Countertransference is a phenomenon that would occur in which the therapist has not done their role of being that unbiased figure that the client can report to. When the therapist has said something misleading or otherwise influenced the client in a direction that interferes with their therapy. So again, this could be when the therapist responds in an irrational way, or when they lose their objectivity because their own conflicts are triggered somehow within that moment. So again, a therapist's own unresolved conflicts can interfere with client assessment and treatment, which we don't want in this method at all. And so there are also 6 basic techniques of psychoanalytic therapy. And these are the 6 things that you really need to make sure that you're looking out for when you use this therapy method, the 6 parameters. So the first one is maintaining the analytic framework. This would be upholding procedural components of therapy, using the basic skills, making sure to stick to the book. Free association, 2. This is a period where clients are encouraged to say whatever comes to mind, and they're encouraged to explore all their thoughts, feelings, ideas that are coming up for them. 3 is interpretation, and this consists of the analysts pointing out, explaining, and even teaching the client the meanings of behavior that are manifested in dreams. Free association, which is again that period where they're allowed to let their mind wander. Resistances, defenses, and the therapeutic relationship itself. The 4th aspect or technique of psychoanalytic therapy is dream analysis. So dreams contain latent content, and latent content is hidden, symbolic, and unconscious material hidden. So in latent content, I could have a dream that could signify to me that I have a complicated relationship with other women, and that would be something that comes up for me, versus manifest content, and this would refer more to unconscious sexual and aggressive impulses. So just to kind of elaborate on that again, manifest content is surface level content, what you remember and report when you wake up, the story, the structure that may have occurred within that dream. That's manifest content. Latent content is any meaning within the dream that had more hidden psychological associations. The 5th component of this framework is the analysis of resistance. And this is anything that works against the progress of therapy. So as we mentioned, therapist reaction can be a big thing. The individual client could also be resistant. They may be unwilling to share some information. because it is vulnerable, it is personal. It could be an environmental concern. Maybe something's distracted the client, so they lose their train of thought. Anything that gets in the way of the method. And then the final component, the analysis of transference, is the client's time to reflect upon outcomes and behaviors. So the book does describe a few points in which the psychoanalytic perspective would be the ideal therapy to use in sessions. The psychoanalytic perspective can be used in sessions when someone would like to understand thoughts, feelings, and behaviors, but they're being evasive, they're canceling appointments or resisting the process. They aren't really sure if their unresolved conflict can be worked through or not. They understand the value of transference or that direct communication with the counselor, and they understand how the ego, which is our most inherent self, protects itself. And this was found on chapter 4, page 90. So, what need did the psychoanalytic theory fill? Why was it created? How is it different from other theories? Freud's psychoanalysis theory was profound at the time as it helped to develop counseling as an applied method rather than a theory. At the time, really only biology and psychology had been observed separately, and the psychology was more neurology based, so it was more literal probing with the brain as opposed to exploring the essence of the mind. And as a result, it filled the need for the presence of counseling within the space that was available. Erickson did release a psychosocial perspective that's similar to Sigmund Freud in that it explores what primarily influences human behavior. But for the most part, Freud's theory was a staple. When did it come about and what was going on in the world at the time? Freud's psychosexual theory began development in the late 19th century. Studies in hysteria marked the beginning of exploration on psychoanalysis, and Freud did later write further literature describing the development of his theory. So in 1900, Freud wrote The Interpretation of Dreams, where he proposed further information regarding the unconscious, repression, and dream symbolism. In 1905, Freud wrote further on psychosexual development in 3 essays on the story of sexuality. And between 1920 to 1930, Freud finished his development of the id, the ego, and the superego. So what are some key concepts, some key words, some important things to know of this method, of this theory? Key concepts to include are evidences for conscious and unconscious behavior. So we mentioned conscious and unconscious behavior, but how do we know that they are real or true things? Well, let's start with unconscious. For example, there's dreams. They are symbolic representations of unconscious needs, wishes, and conflicts. People have slips of the tongue where you accidentally say something you don't mean to say, or you forget something that would be common or familiar to you, like a family member's name or a pet's name. These are things that you know, or you mess up, but it's not entirely intentional. If somebody were to hypnotize you and then they gave you a suggestion for behavior and that influenced you, okay, well, that's an example of unconscious behavior. A material derived from free association techniques are used as proof. Material from projective techniques are used as proof. And symbolic content from psychotic symptoms are also used as proof. So again, the unconscious stores all experiences, memories, and repressed material. And then also included within the theory are what we call naturally occurring life anxieties. So we had life instincts and we had death instincts. Well, then we define anxiety. And anxiety is a feeling of dread that results from repressed feelings, memories, or desires and experiences that emerge to the surface of awareness. And so the three distinct types of anxiety that they mention here are reality anxiety, neurotic anxiety, and moral anxiety. So reality anxiety is fear of danger from the external world, which threatens the safety of the ego, the innermost self. Neurotic anxiety is fear that the instincts will get out of hand and cause the person to do something that they'll be punished for. And moral anxiety is the fear of one's own conscience or fear of defying one's own stated moral code. And it's also important to consider at this time too that Freud was using a lot of his own experience to fuel his research, and so it's very likely that he had some of these feelings and they were kind of coming out here. And I feel like this is one of the areas where you can really see that in this talk about fear and anxiety surrounding, shameful urges. And then what causes hurt or suffering? Hurt is caused by unresolved conflicts during childhood, according to this theory, or the absence of complete development between the oral, anal, phallic, latency, and genital stage. So then, what promotes change? Change is promoted through the exploration of repressed, unconscious desires through professional counseling. And I did also create a Quizlet link that I'd like to share with you guys. And if we're watching this in class, I can pull that up, I can pull that out, and we can get to that. Obviously, we can't in this video, but I do have an activity that we could do for that. But for right now, I'd just like to go over some of the main points that we've discussed. So some of the primary points of this theory are that hurt is caused by unresolved or unmet childhood needs. People undergo 5 psychosexual stages, which include the oral, anal, phallic, latency, and genital stage. Unresolved childhood conflicts or unmet needs result in unacceptable desires, such as an Oedipus complex, for a male, attraction to the mother, jealousy of the father, as Sigmund Freud himself experienced, and a repression of material into the unconscious. Something that I'd also like to mention is that in addition to the Oedipus complex, there's also an Electra complex, which is the female version, which would be the exact opposite. I believe like attraction to your father and then jealousy of your mother. This unconscious material may reappear as anxiety, phobias, or neurotic symptoms. So again, as you're going through all your repressed desires, thoughts, feelings, it's likely to come out in a hysterical adjacent manner. Anxiety, phobia, neurotic symptoms. And these anxieties, phobias, or neurotic symptoms require professional counseling to address. So again, since I can't play the video in this video or play my Kahoot in this video, what I want to actually do is see if I can go through here and ask the questions in video and then allow time for maybe like an answer. So every question that I'm about to ask is something that we've already discussed in this video, just for the last 5 minutes that we're here together. I'm going to ask the question, I'm going to give a handful of possible solutions, and you're going to tell me what you think it is. And if we are playing Kahoot in class, then we can just get to that part. But first one, who is credited for the development of the psychoanalytic theory? Is it A, Samantha Edwards, B, Eric Erickson, C. Sigmund Freud, or D. Davis West? It is Sigmund Freud. Okay, so when utilizing the psychoanalytic perspective in counseling, demonstration of the blank screen approach includes either A, emphasis on personal disclosure, avoidance of neutrality, or B, emphasis of neutrality, avoidance of self-disclosure. Or does it include B, emphasis on neutrality, avoidance of self-disclosure? The blank screen approach includes emphasis on neutrality and avoidance of self-disclosure. This is a true or false question. So the blank screen approach, true or false, is intended to foster freedom of thought within the client to avoid bias. True or false? I'll say it again. True or false? The blank screen approach is intended to foster freedom of thought within the client to avoid bias. This is true. This is a true thing. Again, we want to make sure that we're having productive transference, where transference is the effective communication between the client and the counselor. I have an image here. It's actually of a man lying down and then another one behind him, and he's taking notes. But I feel like that really highlights how, although this is a personal method, it is slightly impersonal because it's very client-oriented and client-led. And then finally, what does a psychoanalytic theory suggest is the primary cause of hurt or suffering a client may see a counselor for? What does the psychoanalytic theory suggest is the primary cause of hurt or suffering a client may see a counselor for? Is it A, difficult time making connections, B, unsupervised playtime in early adolescence, C, poor social skills, or D, unresolved childhood conflict? The options are A, difficult time making connections, B, unsupervised playtime in early adolescence, C, poor social skills, or D, unresolved childhood conflict. The answer is D, unresolved childhood conflict. Again, we have the oral, anal, phallic, latency, and genital stages. Latency and genital are earlier in life, later in life, but all the other stages occur before 6 years old. And then I believe I may have misspoken previously. This is a true or false question. The psychoanalytic theory began development in the early 1890s. So, true or false, the psychoanalytic theory began development in the early 1890s. Is this true or false? Early 1890s. This is true, and I believe I misspoke earlier. I think I said late 1900s, 19th century. I hope I didn't, but the psychoanalytic theory began development in the early 1890s, and that was with the introduction of Freud's earlier material, the studies of hysteria, which he did later develop into other related materials. But yeah, I also think it's interesting how this sort of subject opened the room for exploration not only of mental health as a topic, as a study, as a field, but it did also kind of in a way, offer some insight as to alternative reasons why someone may be expressing themselves as they do, aside from their hysterical. But that is all from me. Thank you for watching. I hope you like this video, and I hope that you enjoy the game and my presentation.